Hi everyone, welcome to Medicine Note YouTube channel. In this video we are going to see about drugs used in heart failure. Digoxin is a major drug. You will see about here. The heart failure means inability of a ventricles to pump the blood out sufficiently. The heart failure means inability of a ventricles to pump out the sufficient blood. Cause of heart failure are valvular disease, hypertension, cardiac arrhythmia. The symptoms of the heart failure are dyspnea, fatigue, dyspnea due to pulmonary edema. There will be increase in pulmonary edema. So, dyspnea, fatigue, reflex tachycardia, edema in legs are seen. Classification of the drug in heart failure. ACE inhibitor, enalapril, ramipril, ensopril. ARB inhibitor are which is angiotensin receptor blocker, which are telmisartan, olmesartan, irbesartan. Beta blockers are atenolol and metoprolol. The calcium channel blockers are amlodipine, nifedipine, and the diuretics are furosemide and spironolactone. These are the drugs which is used in heart failure, and these are the classification of the drugs. An ionotropic drug which is cardiotonic drug is digoxin, dopamine and amiodarone. Now we will see about the major drug which is digoxin. Digoxin, which is a plant source, comes from plant Digitalis latenta. The chemistry is glycoside. It is meaning glucose plus active drug. An active drug is aglaon, which is digoxin. The chemistry of the digoxin is glycoside, which is glucose plus an active drug. It has glucose plus an active drug. The active drug is aglaon, which is digoxin. Cardiac glycoside, the main action on the heart, and it is an cardiotonic drug. The main action is always on the heart. Mechanism of action: inhibit sodium pump, Na plus K plus ATPase, increases intracellular active calcium, that the calcium stimulate actin and myosin fiber, and increases the force of contraction of the ventricle and increases the cardiac output. So there is reverse all symptoms of cardiac heart failure. This is the mechanism of action. The therapeutic uses are the heart failure. The first line of drug is used is ACE inhibitor and ARB, as we seen in the classification. The second line of the drug is beta blockers as well as diuretics. This both are used as second line of defense. When the above two, which first line and second line of drug fails, digoxin is used. Cardiac arrhythmia, atrial fibrillation, atrial flutter, ventricular tachycardia. This digoxin reduces the ventricular tachycardia rate. So it is used in cardiac arrhythmia. Adverse reaction: nausea, vomiting, loss of appetite, bradycardia, ventricular fibrillation and death. And hypokalemia is seen. Increases the digoxin toxicity. These are the adverse effects of the digoxin. Management of the toxicity: stop the digoxin. Oral or parenteral route of K plus supplements are given, which is potassium supplements are given. The ventricular arrhythmia is treated with lignocaine, and the bradycardia is treated with atropine. These are the management of the toxicity when there is more amount of digoxin given. Thank you. For more videos, please do like, share and subscribe my YouTube channel.